Hello. I'm Dr. Aamir. Today we will discuss a medical condition known as dengue fever. Before we start our session, it is requested to kindly subscribe to the channel and share in your community for health awareness.
Dr. Aamir, what is dengue fever?
Dengue fever is a mosquito-borne viral illness caused by the dengue virus. It presents as flu-like symptoms, including high fever, severe headache, joint and muscle pain, and rash. In severe cases, it can lead to denguehemorrhagic fever or dengueshock syndrome, which can be life-threatening.
Dr. Aamir, what are the causes of dengue fever?
Dengue fever is caused by the dengue virus, primarily transmitted to humans through the bite of infected Aedes mosquitoes, particularly Aedes aegypti. Travel to endemic areas and inadequate mosquito control contribute to its spread. There are 4 virus serotypes, and infection with one provides partial immunity to that serotype only.
Dr. Aamir, how to get immune from dengue fever?
Immunity to dengue fever can develop after being infected with one of the 4 dengue virus serotypes. However, this immunity is specific to the serotype you are infected with and provides limited protection against the other serotypes. Preventing mosquito bites through repellents, protective clothing, and eliminating mosquito breeding sites is key to avoiding infection.
Dr. Aamir, is dengue fever vaccine available?
Yes, a dengue vaccine called denguefeversymptoms has been developed and is available in some countries. It provides partial protection against dengue virus infection for individuals who have previously been exposed to the virus. However, its use is limited and controversial due to concerns about its effectiveness and potential risks in certain populations.
Dr. Aamir, what are the signs and symptoms of dengue fever?
The signs and symptoms of dengue fever can vary in severity and typically appear 4 to 10 days after being bitten by an infected mosquito. Common symptoms include high fever, severe headache, pain behind the eyes, joint and muscle pain, rash, and mild bleeding such as nose or gum bleeding. In severe cases, denguehemorrhagic fever or dengueshock syndrome can occur, characterized by severe abdominal pain, persistent vomiting, bleeding, and low platelet count.
Dr. Aamir, what is the prevention of dengue fever?
Preventing dengue fever involves reducing mosquito exposure, using insect repellents, wearing protective clothing, and using bed nets. Eliminating standing water where mosquitoes breed is crucial. Community-wide mosquito control efforts and vaccinations can also help curb its spread. Travelers to endemic areas should take precautions to avoid mosquito bites.
Dr. Aamir, what should I do if I suspect I have dengue?
If you suspect you have dengue fever, seek medical attention promptly. Rest, stay hydrated, and take acetaminophen for fever and pain. Avoid NSAIDs. Monitor symptoms and watch for any signs of severe dengue. Do not self-medicate with aspirin or ibuprofen. Medical care is important to manage symptoms and prevent complications.
Dr. Aamir, what is the treatment for dengue fever?
There is no specific antiviral treatment for dengue fever. Supportive care involves staying hydrated, resting, and managing symptoms like fever and pain with acetaminophen. Medical supervision is crucial to monitor for any signs of severe dengue and to provide appropriate interventions, such as fluid replacement, if necessary.
Dr. Aamir, is there any home remedy for dengue fever?
While there's no cure-all home remedy for dengue, staying hydrated with fluids like oral rehydration solutions, consuming nutritious foods, and getting plenty of rest are essential. Consult a healthcare professional before trying any home remedies, as severe cases require medical attention and self-treatment can be risky.
Dr. Aamir, what is the main problem with dengue?
The main problem of dengue is its potential to cause severe illness, including denguehemorrhagic fever and dengueshock syndrome. These complications can lead to bleeding, organ damage, and even death. The lack of specific antiviral treatment and the challenges of mosquito control contribute to its significant impact on public health in endemic areas.
Dr. Aamir, how many days dengue fever lasts?
Dengue fever typically lasts for about 2 to 7 days, with the acute phase of high fever and other symptoms usually lasting around 2 to 4 days. After this period, most patients start to recover gradually. However, it's important to note that the recovery period can vary, and some symptoms might persist for a longer duration.
Dr. Aamir, why platelet count decreases in dengue fever?
In dengue fever, the virus can affect the bone marrow and immune system, leading to a drop in platelet count, thrombocytopenia. This occurs due to increased destruction of platelets and reduced platelet production. While low platelet count can result in bleeding, severe cases can lead to denguehemorrhagic fever due to abnormal blood clotting.
Dr. Aamir, what diet is best for dengue fever?
In dengue fever, focus on a balanced diet with easily digestible foods. Consume plenty of fluids like water, oral rehydration solutions, and clear soups to stay hydrated. Include soft fruits, well-cooked vegetables, lean proteins, and whole grains. Avoid fried, spicy, and heavy foods that could be hard to digest.
Dr. Aamir, which fluids are best for dengue fever?
In dengue fever, hydrating fluids are essential. Water, oral rehydration solutions, clear soups, coconut water, and diluted fruit juices can help maintain hydration levels. Avoid caffeinated and alcoholic beverages. If experiencing severe symptoms, medical care might involve intravenous fluids to manage dehydration and maintain electrolyte balance.
Dr. Aamir, what are the precautions for dengue fever?
Precautions for dengue fever include using mosquito repellents, wearing protective clothing, and eliminating stagnant water where mosquitoes breed. Maintain good hygiene, especially in surroundings. Seek medical care promptly if symptoms appear, and avoid self-medication with aspirin or NSAIDs. Follow healthcare providers' advice for proper management and recovery.
Thank you, Dr. Aamir. It was wonderful knowledge shared with everyone. I wish to see you about another health topic.
Goodbye, and remember, recovery is nurtured with rest, fluids, and care. Dengue's challenge can be overcome with strength and patience.